Hello, dear aspirants. Your wait is over. So, yes, according to your demands, so we have come up with the memory based questions and answer key of the KGME exams, which yesterday you have all attended. So, this is the complete memory based question session. So, in this one, I have tried to collect all the questions from the aspirants, and with Rationally, I am explaining the each and every question. So, please check your questions and answers which you people have attended in the exam. So without wasting the time, we will move to our session. So here is our first question of the KGMU exam. So the first question comes like this: the normal respiration rate and rhythm is known as. What is the term that is used to describe the normal respiration rate and rhythm? So normal respiratory pattern means the rate and rhythm, everything is normal, means we will mention yes the word as an eupnea. Wherever the word "you" will come, that indicates the normal, means euthyroidism, like normal thyroid function. Okay. Here is the another one. Word is there. Tachypnea means increased respiratory rate. That is called tachypnea. Okay. More than yes 24 breaths per minute increased means that is what we call tachypnea. And what is bradypnea? Bradypnea is the yes decreased respiratory rate. So that is less than 12 breaths per minute. If there means that is what we call the bradypnea. What is eupnea? Eupnea is the yes normal respiration rate with rhythm. That is what we call the eupnea. Means the normal respiratory pattern we call the eupnea. And what is the apnea? Yes, apnea is the absence of the breath. In neonate, if it is so more than 20 second means that is called apnea. Okay, means the absence of the breath in neonate, more than 20 second in the neonate. Yes, very important. The criteria of the apnea. And more than 10 second in adult. If the respiratory efforts are not visible for more than 20 seconds in the neonate means that is what we call the apnea. And in the yes in the adult, if it is more than 10 seconds the respiratory rates and rhythms is not visible means that is what we call the apnea. Okay, so this is the your answer goes here eupnea. ಯಾರು ಯೂಪ್ನಿಯನ್ನ ಮಾರ್ಕ್ ಮಾಡಿ ಬಂದಿದ್ದೀರಾ, ಸೊ ಯುವರ್ ಆನ್ಸರ್ 100% ಕರೆಕ್ಟ್ ಇದೆ. ಓಕೆ, so let me go for the next question. So here is the question. One female client complaints of the curdy white discharge. What kind of the discharge? Curdy and white color discharge is there. Okay, and itching means the pruritus means the itching is there, and foul smell in the vagina. So curdy white discharge is coming from the vagina, itching is there at the vaginal area, and foul smell is there in the vagina. So what it indicates? What it indicates? Which of the following? See, trichomonia vaginitis, Candida albicans, bacterial vaginosis, atrophic vaginitis. Okay. Let me explain the rationale, how we will differentiate. See, any female comes with complaints. Okay. So, this is the question related to the topic of vaginitis. Okay. What is the vaginitis? Infection and inflammation of the vagina. Here we are having the various kind of the vaginitis in the among this. Very important where the examiner asks is bacterial vaginosis, and Candida vaginosis, and another one we are having yes trichomonia vaginitis. Yes, what are the clinical manifestations in the bacterial vaginosis? In bacterial vaginosis also there is an white to gray color discharge with foul smell. But the very important point to differentiate your answer, there is no itching. If in the question itching or prurite is given means the answer not goes to bacterial vaginosis. Means there is no itching if the examiner given in the question history means the answer goes to bacterial vaginosis. White or grey discharge with foul smell with no itching is the bacterial vaginosis. In Candida there is an white color discharge, okay, or like a curdy means the discharge looks like curd, and with, yes, the foul smell, very important to differentiate, okay, with intense itching or the pruritus, what we call the itching, very important. If all these three, the white color discharge, foul smell, and itching is there means the answer goes to, yes, the bacteria, sorry, the Candida fungal infection, okay, Candida vaginosis or the Candida moniasis. Here is the Trichomonas vaginitis. So in Trichomonas vaginitis, it's an, yes, the very importantly Trichomonas vaginitis is then, yes, flagellated protozoal infection. So here the discharge is in the, yes, the very important green color with foul smell, yes, along with itching. If the examiner is asking the green color discharge with foul smell with itching means the answer goes to Trichomonia vaginitis. But in our question, it is a white curdy color discharge with foul smell with itching or pruritus there. So the answer goes to candidiasis. If there is the single word changing means the entire answer is changing. Friends, here is the foul smell with itching is given in the question. Means in the bacterial vaginosis there is no itching. So eliminate the option. And in the Candida monidiasis, there is itching, there is curdy white discharge, and there is foul smell. So the criteria sets for this question. Here is the answer for this question is the Candida moniasis. And if in the question the green color discharge with the foul smell with the, yes, the intense itching is there means it goes to the answer as in Trichomonia vaginitis, the flagellated protozoal infection. Okay. So what is the atrophic vaginitis? Atrophic vaginitis which occurs due to decreased estrogen in old age females. Okay, so in old age ladies it occurs due to decreased estrogen means this is also called as an senile vaginitis, means the vaginitis is occurring due to the age process. So here our treatment is the estrogen cream we will advise here. Okay, what is the estrogen cream for local application we will advise here. So very important question, this is also atrophic vaginitis. So here is the rationale for your question, very important. This question, friends, asked in your last aims, as the NORCET exam, also in the mains exam. So same question, the history is given like same, cardiovide discharge, itching, false smell. If there is no itching, the answer goes for the bacterial vaginosis. If the itching with green color discharge, the answer go for the, yes, the Trichomonia vaginitis. And with itching, this is white curdy color discharge with false smell, the answer go for the, yes, the very important, that is the Candida moniasis. Very important. So this is our next question. So let me discuss this question in detail. Thumb uppy deformity is due to compression of which nerve? The question is like this, the very important question. The repeatedly asked questions only asked in the Kgmu exams. If you are solving the last 4 to 5 years question bank means you have to clear this exam. Okay, so but the concept have to be clear to clear this exam. Very important. So it is somewhat moderate to tricky paper. Okay, so the thumb uppy deformity is due to which nerve compression? The very important question. Okay, it may be, yes, the option comes like an option A is the radial nerve, option B is the ulnar nerve, option C is the median nerve, option D is the axillary nerve. Okay, so the thumb upper deformity is due to which nerve compression? Here is the rationale for your question. See, so if there is damage or the compression of the, yes, the radial nerve means that is the wrist drop occurs. Okay, we call the drop hand. Okay? All the wrist drops that is occurs due to the radial nerve damage. And if the ulnar nerve is compressing means, so ulnar nerve is compressing means we will see the claw hand syndrome means last this the short finger and the ring finger, there is loss of sensation and movement from these two means it's due to the yes the ulnar nerve compression. Ulnar nerve is supplies the ulnar border this side. So if the ulnar nerve got compressed means these two fingers, these two, okay, means the ring finger and the short finger, so or the little finger. So which these both will got loss of sensation and the movement means that is due to the yes the compression of the ulnar nerve. Okay, so this is what we call the claw hand. If the median nerve is got compressed means these three, one thumb and the little finger, sorry, middle finger and this finger. So both these three finger along with half of this finger, okay, along with half of this finger will get loss of the sensation with movement means this half finger, this one, so ring finger, so half of is supplied by the ulnar nerve and half will supplied by the radial nerve. So this is very important. So half of this finger, middle finger, and our very important thumb. So all these fingers are getting loss of sensation and loss of movement means we are having the yes the ulnar nerve compression. That is what we call the carpal tunnel syndrome. Okay, the very important point you have to keep in your mind. Okay, here the upper thumb deformity. Upper thumb means what is the meaning of the upper thumb? Upper thumb means the thumb is getting the loss of the motor movement and the thumb is attached here like this and which is not abducting out. So that is what we call the upper thumb deformity, which occurs due to the compression of the median nerve and which is also seen in the yes our carpal tunnel syndrome. Very important. So the answer for the question goes like here. So in the radial nerve compression we are seeing the yes the wrist drop. Okay, in the ulnar nerve compression we are seeing the claw hand syndrome. Okay, in the median nerve compression we are seeing the yes the very important our upper thumb deformity along with carpal tunnel syndrome. Okay, very important. And in the axillary nerve we will see the damage of the axillary nerve. Here is the axillary nerve which supplies at the axilla, this yellow color one. Okay, focus on this. This red color one are the arteries. This is the humerus circumferential artery and this is the humerus circumferential vein, this blue color one. And here is the yellow color one which supplies the, which gives branch to here. So to the part of our deltoid muscle also, when we give intramuscular injection in the deltoid nerve, there is highest risk of got damage of the axillary nerve. Means the examiner may ask like this also, which nerve is get damaged in the yes inappropriate technique of the deltoid muscle intramuscular injection. Here our axillary nerve is got damaging. Okay, and if we are using the yes the crutch while we're using the crutch walking, the inappropriate technique where the person is not maintaining the 3 to 4 finger gap between the axilla and the our pad of the crutch means the compression which is repeatedly arranging in our axilla which compresses the axillary nerve. Okay, this is leads to the paralysis of the hand. Okay, the very important. So in our intramuscular injection abnormally we are using in the deltoid muscle means axillary nerve got damaged, and in the crutch walking also abnormally we are using improper technique means again the axillary nerve got damaged. Okay, very important. So this is the rationale for your questions very importantly. So let me move for the next question. Here is the answer goes to yes the thumb upper deformity is due to compression of the yes the median nerve. Okay, yes, here is your next question. So the healthcare provider order the 2000 ml of the fluid in the rate of the 250 ml per hour. So what is the total time required to complete the fluid? Okay, what is the how much total time you have required? So you are having the 2000 ml of the fluid. Okay, and per hour you are infusing the 250 ml. Okay, means so 250 1 is 250 and it's 250 8 is 250. 2000. Okay, so in 8 hours we will complete our fluids. Per hour, 1 hour we are infusing 250 ml, means in 8 hours we will complete our 2000 ml. Here is your answer for this question. Very easy calculation they have asked in exam. Okay, so let me move for the next question. Yes, who is the Rajyapal of the Uttar Pradesh? They have asked. Rajyapal of Uttar Pradesh is Anandaben Patel. Anandaben Patel is the Rajyapal of your Uttar Pradesh. Okay, so this is the one general knowledge question. And fluid of choice in the management of the hypovolemic shock. So patient is in the hypovolemic shock. What is the fluid of choice? So we are having the option as an isotonic crystalloids. Here in the isotonic crystalloids, we will or 0.9 percentage of the normal saline will come. Okay, very importantly, hypotonic means 0.45 percentage of the normal saline will come. Hypertonic means yes, 3% of the normal saline will come. Colloids means we are having the albumin, dextron. These are our plasma expanders. Very importantly, we will use in the burns also. So, what is the fluid of choice in a patient with the hypovolemic shock? The patient is in the hypovolemic shock means the volume is in the lowest side in the body. Okay, so low volume is there in the body. So you will replace that one. So how you will replace? See, let me explain the rationale for this one. You only will tell the answer for this. Yes. Sorry, 1 minute, please. Give me a minute. Yes. So let me answer for this question. See, this is our cell. The space which is present inside the cell is called intracellular area, and this is our yes the beautiful vein or the blood vessel. This is what we call intravascular area, and this is the extravascular area. This is the intracellular area, this is the extracellular area. Okay, so where we are giving the this is the IV cannula I am putting here in this vein. Okay, so through this IV cannula I am giving the isotonic solution. What is the isotonic solution? Iso means the similar to the yes the plasma osmolality. What is the normal plasma osmolality? To 85 milliequivalent per deciliter is the normal plasma osmolarity. If the fluid you are giving is equal to the plasma osmolarity, means that is what we call the isotonic, means same. So our fluid is osmolarity also same like 285. Okay, so uh, if it is both are same means it's an isotonic. Okay, so I am giving this one means so this fluid will go here and this will not shift outside also, and it will not pull from outside also, so which will helpful for the expanding the our intravascular fluid, so which will increases the circulatory fluid. Okay, very important. This is what we call the isotonic solution. So and in the hypotonic solution, yes, in the hypotonic solution, yes, 1 minute. If consider this is a cell and this is the vein. Okay, so we are giving the hypotonic solution, means the tone of the solution is very low, means the solid particles that is present inside the solution is very low, means we are giving the diluted one. Okay, or hypotonic solution means here is the high concentration and here is the low concentration, because we are giving the diluted or the hypotonic, means the less concentrated fluid. So due to the concentration gradient, this the given fluid shift from intravascular space to yes the extravascular space, and which may go inside the cell also. So shell, what happens here? Cell swelling occurs here, we can say. Okay, so the hypotonic solution which increases the intracellular fluid and which decreases the intravascular fluid. Okay, increases the intracellular fluid and decreases the intravascular. So here, if we are giving this one means the fluid will shift. Whatever the fluid we will give, the fluid will continuously keep shifting. So it will not treat the hypovolemia. So that's what we will not give the hypotonic fluid. Okay, and if we are giving the hypertonic solution like this, consider this is a cell and this is the vessel. Okay, so we are giving the hypertonic means hyper means increased tone means the osmolality is more than the plasma. Okay, so the osmolality is more than the plasma means here is the higher concentration because we are giving the hypertonic solution we are giving means the tonicity of the solution is the osmolarity of the solution is the more than the plasma osmolarity. So here is the due to higher concentration because we are giving the hypertonic fluid here. So increased concentration here is the it pulls the fluid from outside the vessel to inside the vessel. So which increases the which increases the intravascular fluid. But how it is increasing the intravascular fluid? It increases by pulling the fluid from the fluid. So because of this, shell shrinkage occurs. Shell shrinking means so we are given the hypertonic solution. Cell swelling occurs means we are giving the the diluted solution. Very importantly, so we don't want to decrease the intracellular fluid because this is also very important. So we have with our main purpose is to restore the fluid means we will not pull out. We will increase we will expand the fluid that is inside the vessel. So we will give the that kind of the solution that may not shift from intravascular to extravascular and intracellular to extracellular. So that's what we will give the the isotonic solution we will give here in this question. Okay, very important. So who and all they answered for the isotonic solution. There is isotonic crystallite 0.9% NH. Your answer is 100% correct. Okay, so let me move for the next question. Which of the following indicates the magnesium sulfate toxicity? Very, very important. Option A given that is increased respiratory means tachypnea. So tachypnea doesn't increases the magnesium sulfate toxicity. If in case respiratory depression, so if in case respiratory rate is less than 12 means 12 breaths per minute means it indicates the respiratory depression which is an occurs in the MgSO4 toxicity, that is the magnesium sulfate toxicity. But here in the option is the increased respiratory rate. So if the respiratory rate is less than 12 breaths per minute means so that indicates the the bradypnea. So it indicates the the magnesium toxicity. But the given option is increased respiratory rate, so it eliminates this option. And in case of which increase urine output, so here it is also not because here magnesium sulfate toxicity occurs means the urine output will decrease. Okay, urine output will decrease, that is less than 30 ml per hour. Okay, decreased urine output. Yes, I have told already the in magnesium sulfate toxicity urine output decreases. Okay, so decreased weight no, weight increases here. How? Because due to the fluid retention weight increases because decreases the urine output means the fluid retaining inside. Fluid retaining inside means the weight is increasing. So we will eliminate the option D also here. So our answer of this question goes to the decreased urine output is indicating the MgSO4 toxicity. Remember one more point. If the respiratory rate is less than 12 breaths per minute, if the urine output is less than 30 ml per minute, and if very important deep tendon reflex is absent means these all points indicates to withhold the magnesium sulfate dose. Okay, MgSO4 will give to treat the the severe preeclampsia and eclampsia. Very important. So this is the answer for our question. Which of the following indicates the MgSO4 toxicity? I told if the respiratory rate decreases, it's in less than 12 breaths per minute, it indicates the MgSO4 toxicity, and urine output which decreases the less than 30 ml per minute, which increases the Yes, the decreased urine output indicates the magnesium sulfate toxicity, and the absent of the deep tendon reflex indicates the MgSO4 toxicity. Okay, if your answer mentioned as in decreased urine output, you are 100% right. Okay, so let me move for the next question. Why injection vitamin K is given externally to the newborn? So एक न्यूबॉर्न पैदा हुआ तो मीन्स न्यूबॉर्न ಹುಟ್ಟಿದ್ರೆ ನಾವು ಏನ್ ರೀಸನ್ ಇದೆ ವಿಟಮಿನ್ ಕೆ ಇಂಜೆಕ್ಷನ್ ಎಕ್ಸ್ಟರ್ನಲಿ ಕೊಡಕ್ಕೆ? ಬಿಕಾಸ್ ಸೊ ಆಲ್ಮೋಸ್ಟ್ ಆಲ್ ವಿಟಮಿನ್ ಕೆ ಎಕ್ಸ್ಟರ್ನಲಿ ಯಾವುದು ಇನ್ ಬರ್ತ್ ಆದ್ಮೇಲೆ ಕೊಡಲ್ಲ, ಓನ್ಲಿ ಇಂಜೆಕ್ಷನ್ ವಿಟಮಿನ್ ಕೆ ಕೊಡ್ತೀವಿ. ಸೊ ಆಮೇಲೆ ವಿಟಮಿನ್ ಡಿ ಆಲ್ಸೋ ಕೊಡ್ತೀವಿ. ಎಕ್ಸ್ಪ್ಲೇನ್ ಮಾಡ್ತೀನಿ ನಾನು ಪೀಡಿಯಾಟ್ರಿಕ್ಸ್ ಕ್ಲಾಸ್ ಅಲ್ಲಿ ಹೇಗೆ ಕೊಡ್ತಾರಂತ. ಬಟ್ ಇಂಜೆಕ್ಷನ್ ವಿಟಮಿನ್ ಕೆ ಎಸ್ ದ ವಿತ್ ಇನ್ 24 hours, ವಿತಿನ್ 24 hours ಅಲ್ಲಿ ಕೊಡಬೇಕು ಇಂಜೆಕ್ಷನ್ ವಿಟಮಿನ್ ಕೆ. ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ಟು ಪ್ರಿವೆಂಟ್ ವೈ ಮೀನ್ಸ್ ಟು ಪ್ರಿವೆಂಟ್ newborn hemorrhagic diseases. Okay, very important. Newborn hemorrhagic disease control ಮಾಡೋಕ್ಕೆ ಸೊ ನಾವು ಏನ್ ಕೊಡ್ತೀವಿ? ಇಂಜೆಕ್ಷನ್ ವಿಟಮಿನ್ ಕೆ ಕೊಡ್ತೀವಿ. ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ಸೊ ಯಾಕೆ ಕೊಡ್ತೀವಿ? ಯಾಕಂದ್ರೆ ಆಪ್ಷನ್ ಎಲ್ ನೋಡಿ, ನ್ಯೂಬಾರ್ನ್ ಗಟ್ ಇಸ್ ಸ್ಟೆರೈಲ್, ಸೊ ಅದಕ್ಕೆ ಕೊಡ್ತೀವಿ. ಯಾಕಂದ್ರೆ ಇಂಜೆಕ್ಷನ್ ವಿಟಮಿನ್ ಕೆ ಅಲ್ಲಿಂದ ಆಕ್ಟಿವೇಟ್ ಆಗುತ್ತೆ. ಸಿ ಲೆಟ್ ಮೀ ಆನ್ಸರ್ ಇಟ್. So this is the gut of the means the large intestine. Here is the normal bacterial flora is there that helps to produce the yes vitamin K1 to K2. So this K2 helps for the prevention of the newborn hemorrhagic diseases here. So because of this, so baby do sterile gut means the large intestine is completely sterile, means there is no bacterial flora, so there is no vitamin K synthesis, means there is deficit vitamin K in the newborn. So because of that we will give the injection vitamin K. Here is this is your answer. So newborn gut is sterile, so that is the reason why we will give the internal vitamin K externally. Okay, so to protect from the infection ಇಲ್ಲ ನಾವು infection ಇಂದ protect ಮಾಡ್ಲಿಕ್ಕೆ ವಿಟಮಿನ್ ಕೆ ಕೊಡತ್ತಿಲ್ಲ. So it not stored in the mother, so that is the not reason to inject the vitamin K. So vitamin K doesn't increases the growth rate. Okay, so the reason behind to inject the vitamin K in the newborn is the only one reason, that is the newborn gut is sterile and if the newborn liver is immature, so that is the reason why we will give the injection vitamin K. Okay, so this is the guidelines by the National Health Mission for the inject prophylactic of the vitamin K. So who will receive the injection vitamin K? All newborns, irrespective of their birth age. Means if the newborn is more than 1000 gram, also he will receive the injection vitamin K, and less than 1000 also he will receive the injection vitamin K. But the dose varies. The very important, I will tell the dose and what all are the preparation. The means the availability of the vitamin K in the market is, in the market we are having the 1 gram 1 mg per 1 ml, and we are having the 1 mg for 0.5 ml also. So very important. And the site and route of the injection, yes, the dose of the injection is, yes, very important, updated one. If the weight of the baby is more than 1000 gram, means we will give the 1 milligram, means 1 mg of the vitamin K, that is the 1 ml vitamin K we will give. Okay, very important, you have to focus on the mg, not in the ml. Okay, very important, while giving the vitamin K you have to see the vial. So what is the preparation that is given on the vial? So if the baby is more than 1000 gram, we will give the 1 mg of the vitamin K intramuscularly. If the birth weight of the baby is less than 1000 gram, means we will give the 0.5 mg only. The very important, the 5-star question for your exam. Okay, again here very important. Okay, the site. So don't know how many times the question is asked from the site of the injection of vitamin K in the newborn. So that is the anterolateral aspect of the thigh intramuscular injection we will give. So very important, anterolateral aspect of the thigh ಮೇಲೆ ಕೊಡ್ತೀವಿ ನಾವು injection vitamin K. Okay, so very important 5-star topic this one. Okay, so who will give? All the medical officers and the staff nurse and the nursing officer, ANMs also can give this injection. So this is not that much important. So The important point I have discussed here, we will give for whom we will give for all the newborns, we will give the injection vitamin K, and the preparation comes like 1 mg per 1 ml and 1 mg per 0.5 ml also. So if the weight of the baby is more than 1000 gram, means we will give the complete 1 mg of the vitamin K intramuscularly, that is in the mediolateral aspect or anterolateral aspect of the thigh intramuscularly. Okay, and who will give? The medical officers and the nursing officers also can give, and ANMs also can give. So very important point. Okay, so when we will give means we will give the, yes, within 24 hours, not more than 24 hours. Within 24 hours only we will give the injection vitamin K. Okay, so this is the guidelines from the National Health Mission for you all regarding the vitamin K prophylaxis. So next question is the, here is, after 3 days of the newborn, the mother complains of weight loss of baby. Okay, so what is the best response by the nursing officer? See, so one mother is complaining after the 3 days of the her delivery regarding the weight of her baby. So she is complaining like this: my baby weight is decreasing. So what is the best response by the nursing officer in that particular situation? So advice to increase the feeding. ಸೊ ನಿಮ್ಮ ಬೇಬಿದು ಬರ್ತ್ ವೇಟ್ ಕಡಿಮೆ ಆಗ್ತಿದೆ, ನೀವು ಫೀಡಿಂಗ್ ಇನ್ಕ್ರೀಸ್ ಮಾಡಿ ಅಂತ ಹೇಳ್ತೀವ? ಇಲ್ಲ. ಸೊ ವಿಲ್ ನಾಟ್ ಟೆಲ್, ಬಿಕಾಸ್ ದಟ್ ಇಸ್ ಎ ನಾರ್ಮಲ್. ಸೊ ಅಸೆಸ್ ದ ಬೇಬಿ ಫೀಡಿಂಗ್ ಪ್ಯಾಟರ್ನ್. Yes, we will assess the baby feeding pattern, but in this situation we will tell the mother it is a normal, your baby will gain weight again. Okay, we will tell this is a normal, your baby will gain weight again, because 10% of the body weight will decreases in the first 10 days. Okay, so after that it will regain again within 10 days. Okay, within 10 days it regain again the what all of the weight he lost. Okay, so very important, we have to keep in your mind, it's a normal baby. It's a normal for your baby, it will gain weight again, we will tell. And I was to start weaning. Okay, so weaning, when we will start, we will start after the 6 completed months. If complete 6 months completed means we will start the weaning. The baby is only 3 days old, so we will not start the weaning. Okay, so your answer for the question is here, it's a normal, your baby will gain weight again. Okay, very important. Yes, let me move for the next question. So which disease occurs due to the contaminated food and water? See, the disease that occurs due to the contaminated food and water, that is a measles? No, it's not measles. Is this malaria? No, malaria is a vector-borne disease that occurs due to the, yes. Yes, tell me, that occurs due to the which mosquito? That is the female Anopheles mosquito. Okay. Anopheles mosquito. Which female Anopheles? Okay. Very important. And is this the typhoid? Is this the dengue? No, it's not dengue. Dengue occurs due to the, yes. This is also ectodermal disease occurs due to the Aedes aegypti mosquito. Bite of the Aedes aegypti mosquito. Okay. So the fecal-oral route that occurs due to the having the contaminated water and food is your answer goes to the typhoid. If you are mentioned the answer as the typhoid, means your answer is 100% correct. Okay. So measles occurs due to the, yes, the respiratory situation spread. So cannula used to infuse the IV fluid in the newborn is your next question. So here is your first option, that is the 16 gauge cannula, 18 gauge cannula, 22 gauge cannula, 24 gauge cannula. We will use the 16 gauge cannula? No, 16 gauge cannula is used in the, yes, emergency. Okay, 18 gauge cannula is used in the, yes, for the blood transfusion. And 22 gauge cannula is not in specified, it is used in the children's. And 24, that is the yellow one, will use it in the, yes, newborns for the IV fluid infusion. Okay, very important. Let me explain with rationale, because this is a very important repeatedly asked question. So here is the gauze of the IV cannula: 14 gauze orange color, 16 gauze gray color, yes, the 18 gauze green color, 20 gauze pink color, 22 gauze blue color, 24 gauze, yes, the yellow color. What is the flow rate of the orange color? That is, yes, the very important 270 to 300. Okay. What is the flow rate of the yellow one? That is the 170 to 200. Okay. What is the flow rate of the green color IV cannula? That is the 18 gauge IV cannula. Yes, that is the 70 to 100. Okay. And what is your 20 gauge pink cannula flow rate? That is your, yes, the 55 gauge, 55 ml per minute. Okay. So again here the 22 gauge blue one is the 33 ml per minute we can infuse, and in the yellow one we will infuse 22 ml per minute. To keep remember easily, I have mentioned these word here. It's in 22 to 25, it's in 33 to 35, it's in 55, it's in 70 to 100, and it's in 170 to 200, it's in 270 to 300. Very very important. 70 70 70 double five double three double two. To keep in your mind, this is the flow rate of the, yes, the IV cannulas. The orange color one you will use rarely, and in 16 color one you will use it in the emergency department. Okay, very important. And the 18 color, that is the green color, we will use it for the blood transfusion and for the pre-operative patients. Okay. So pink color one you will use regularly in the adult. Okay. So regularly for in the adult for the IV fluid transfusion and all you will use the, yes, routinely you will use the pink color one and the blue color. So no any specificity of this cannula, but you will usually use in the children's between the age 10 to 16 year age. Okay. And if it is less than 8 year, you will always try to put the yellow color cannula to infuse the IV fluid and all. Okay. So this is used in neonate also. Okay. Neonates and infants. Very important. So this is the, yes, very important points you have to keep in your mind. So gauze and flow rate is the very important you have to keep in your mind. And the special thing I have told, gray is for used in the emergency department, and green is in the blood transfusion and pre-operative patients. Pink for the, yes, in adults for IV regular infusion. Yes, the blue is also in the children's between the age of 10 to 16 years, and yellow is for the neonates and infants. Very important. You have to keep in your mind. So here is the one more question for you all. What is the category of the mental retardation in person with the his IQ is 30? So we are having the IQ categories that indicates the your levels of the mental retardation in the children's. If the IQ is 50 to 70, it's a mild mental retardation. If the IQ is, yes, 35 to 50, that is your moderate level of mental retardation. If the IQ is 20 to 35, that is the severe level of the mental retardation. And if the IQ is less than 20, that is your profound level of the mental retardation. These minds are educatable, so we can educate them. And this moderate one are trainable. Okay, we can train them to carry out his daily living activities. We can train. So this severe and profound one requires a special training in the, yes, special care units. Okay, special care unit is required. Special care centers are required to take care of this one, because the severe and profound mental retardation babies are not even they carry the activities of the daily living also. They are dependents. Okay, they are completely dependents. Very important. So here is our answer. The IQ is the, yes, the 30 means it is a severe mental retardation. If you are mentioned the answer as in severe, it's your answer is 100% correct. So we'll move for the next question. Okay. What is the appropriate time to insert the intrauterine contraceptive device? This is your one more question again in your Kgmu exam. So option A comes at the mid of the cycle. No, we will not insert at the mid of the cycle. Just before the menstruation. No, we will not insert just before menstruation. Anytime during the menstruation. No, we will insert first 10 days of the, yes, menstrual cycle, because because means the internal cervical os or the opening is the cervical os is open. So without difficulty, without pain, we can insert easily IUCD. Okay, intrauterine contraceptive device we can insert easily during the first 10 days of your the menstrual cycle. Why? Because during the bleeding, the internal organs is open, so we can insert easily during first 10 days of the menstruation. So very important. Okay, so this is your answer. So let me go for this question. Very important. What is the myopia is corrected by the which lens? Okay, here is the question like this. Myopia is corrected by the which lens? Very important. I will explain you with rationale. See, this is our a beautiful cornea. This is the lens, and here's the sensory neuronal layer, retina. Okay, retina. This is the normal eye, means immetropia, means the normal refractory functions here. Okay, see, light rays are coming like this. Okay, and bending at the lens, and which are directly focusing on the retina. Very important. So that is the normal function. So emmetropia we will call that one. If in case light rays are over bending due to the over function of the lens, the focus will come in front of the retina. See, the focus is here in front of the retina, means the person ಇವ್ರು ಏನಾದ್ರು ನೋಡ್ಬೇಕಂದ್ರೆ ಯಾವುದೇ ಒಂದು ಅಬ್ಜೆಕ್ಟ್ ಬಹಳ ನಿಯರ್ ಹಿಡ್ಕೊಂಡಿಟ್ಟಿರ್ಬೇಕಾಗುತ್ತೆ. ಸೊ ಅದಕ್ಕೆ ಇದಕ್ಕೆ ಏನ್ ಕರಿತೀವಿ ನಾವು ಶಾರ್ಟ್ ಸೈಟೆಡ್ನೆಸ್, means the person is able to see only short object, or the near sightedness means the person is able to see only the near objects. That is what we call the myopia also. Okay, so here is the long sightedness, means see, the lens is not working properly and light rays are not bending properly, which is the focus is going behind the retina. Okay, if the focus is going behind the retina, means this lens is not working properly. That is what we call, if we this person he able to see, means he should hold the objects very far, so then only the light rays will comes on the retina, so he can see. So the person he can able to see from very far away objects and he is unable to see the near object, means let's your long sightedness we call the hyperopia. This is the thing. Okay, so what happened actually, this is overbending. Short sightedness means in myopia it's an overbending. So it's overbending means we will put opposite one. See, this is what we call the biconcave. So biconvex lens means both side is the convex one. See, let me this is C, this is it. To remember this one you have to write this X, that is the convex, means it's bended by both side. Okay, this is called what we call the biconvex lens, and this is double C1. Okay, सीधा C उल्टा C, we call this is a two side concave is the biconcave lens. Okay, so if the light rays are over bending, means we'll put the opposite one in front of this, so the light rays goes somewhat diverted, and which is helpful to bend over the retina. So to treat the myopia we uses the the biconcave lens. Okay, very important. So here we treat the myopia, we are using the the biconcave lens. So here the lens is not working properly and the light rays are not bending properly. Light rays are going behind the retina to focus. So you have to bring this one from here to here, the red color one you are seeing. So in order to that one, we will insert or we will put the eyeglass with the the biconcave shape lens. So we are keeping the biconcave shape lens, means the light rays bends here and which is helpful to focus over the retina, so person can see easily. Okay, so the question is like this: the lens that is used to correct the myopia, means the nearsightedness, is called the our answer goes to biconcave shape lens. The biconcave shape lens we will use here to treat the myopia. Okay, so the very important, who all are the mentioned the answer as in biconcave lens, so your answer is 100% correct. Okay, so here is the next question. So intrathecal injection is given in which of the following? Intrathecal injection is given in which of the following? If it is given in the vein means we call that is an intravenous injection, not intrathecal. If it is given in the yes artery means we call that is intra-arterial injection, that is the yes not in intrathecal. If it is given in CSF or in the subarachnoid space, that is what we call the intrathecal injection. Okay, very important. Who all mentioned the answer as in subarachnoid space or the inside the CSF? Your answer is the 100% correct. Okay. So if it is giving inside the bone marrow means we call that is an yes intraosseous. That's the best route after the IV. If the IV is not getting in the children's means the first best next route is the intraosseous one. If you are giving the injection inside the joints, inside the two bone joints means that is intra-articular, we will say. So we will discuss in the route of the medication is medication administration. So here is the answer for this question. Intrathecal injection is given in which of the following? That is given in the inside the subarachnoid space or in the yes in the CSM. So that is the answer for your question. Here is the next question. While taking care of the patient with GB syndrome, Guillain-Barré syndrome, which of the following nursing diagnosis takes priority? So the first priority nursing diagnosis in the patient with the GB syndrome is always goes for the yes, the respiratory depression. Why? Because this is considering this is the person with JB syndrome. So in almost all diseases, okay, paralysis occurs from upward to downward like this. But in the GB syndrome, paralysis occur from the yes downward to upward. That is we call the yes ascending paralysis. We see that is an ascending paralysis, the classical picture of GB syndrome. Okay. So when the muscles of the lower extremities or periphery got weak, then weak. When we comes for the respiratory, if the main muscle of respiration, that diaphragm is getting weak, means the respiratory failure occurs, means the gas exchange will not occur. The respiratory, see impaired gas exchange goes the as the priority nursing diagnosis or the action in patient with the JB syndrome. Okay, so the very important imbalanced nutrition status is not a priority. Anxiety related to disease is not priority. Altered level of consciousness is also, or the level of sensorium is also not a priority. Here the answer goes that impaired gas exchange is in as well priority nursing diagnosis when the treating patient with the Guillain-Barré syndrome. Okay, so this is your next question. So which of the following is not an appropriate nursing action in patient with the epistaxis? The very important question. So read the question carefully. The word not mentioned. Okay. So we will. What is the epistaxis? Epistaxis is an yes nose bleeding. Nose bleeding we call epistaxis due to the damage to which area? Little area of the nose. Okay, where the all vessels plugins. That means the all vessels will comes together and goes from this area. This is the little position in the nose. When there is a direct impact or damage or to the any uh, bleeding disorders where the damage to this plexus occurs from here, the bleeding occurs in the nose. That is what we call the nose bleeding or the epistaxis. If the patient is suffering from the epistaxis, means we are having the very important first aid. So that is the first aid is the first we will pinch the nose where they are on the side of the bleeding. Then again we will lean forward and ask the patient to breathe through mouth, because the we are pinching the nose means we are the closing the nose. So we will never ever ask the patient to head lean backward. If he is leaning backward means the blood will go yes inside the trachea or inside the esophagus. So that is what we don't want. Okay. So very important. So the answer for the question goes here. Which of the following is not an appropriate nursing action? We are doing the pinching the nose also. Yes. Head leaning forward also and breathing through mouth also. We are not entertaining to head lean backward. Okay. So this is the what your answer of the question. Okay. Very importantly. Okay. So let me move for the next question. Important nursing assessment after the infusion of the mannitol to the patient with the cerebral edema. I have explained this one in my head injury topic. So very importantly, what is the medication of choice to decrease the intracerebral pressure means that is the our hyperosmotic injection, that is the mannitol 20% is one. So what I told, this is the brain cell. When we infuse the mannitol here, this is an hyperosmotic one. So it's hyperosmotic means it's an increased concentrated, so which pulls the fluid from the cerebral cells into the vessels. So this the which increases the intravascular area means which increases the renal flow and which increases the, yes, urine output. And the mannitol is an osmotic diuretic. So we are giving this mannitol to treat on to decrease the intracerebral pressure. So very importantly, and it is also an osmotic diuretics. We will assess for the urine output of the patient. So when important nursing assessment or giving the mannitol is, yes, we will assess for the increased urine output. If the urine output is increased means the fluid is coming out of the body, and if the fluid is coming out of the body, yes, the cerebral edema is decreasing. This is how we will assess the effectiveness of the mannitol also, and assess for the weight of the client. So weight of the client also we can assess, but it's not associated with this question. So increased oral intake. So we'll ask the patient to have the fluid that is the less than 1 liter per 1 day. Why? Because already increased intracranial pressure is there, 1.2 liter per 1 day. Okay. So already increased intracranial pressure is there. So in order to decrease this one, so we'll ask the patient to have the fluid that is less than 1.2 liter per 1 day. Very important. Okay. So this is not our answer. So answer goes is the option A, monitor for the urine output. Okay. So very important one. And here is the, this is also one question asked in your Kgmu exam. That is the formula of the, or how you will calculate the body mass index. So body mass index is calculated by, yes, weight in kg divided by, yes, height in meter square. Very important. This is the formula where we will calculate the body mass index, and this is also called as an Quetelet index. Body mass index is also called as Quetelet index. Here is the, yes, the Indian classification of the body mass index. The normal BMI is 18.5 to 22.9. This is the, we are having the two different classification, in the Asian classification and the WHO Indian classification. Also very importantly, we will follow here the Indian classification. So which indicates the nutritional status of the patient. The normal BMI is the 18.5 to 22.9. So if the BMI is less than 18.5, so we will consider those patients as an undernourished or underweighted patient. And if the body mass index is 23 to 24.9 means that's the overweighted. More than 25 to up to 29.9 means we will consider as obesity classification 1, and in the more than 30 means we will consider as an obesity classification 2. Very importantly, this chart you have to remember, because in upcoming exams may ask directly what's the normal range of the BMI. Means normal range of BMI is from 18 to, yes, 18.5 to, very importantly, 22.9. We are having the another Asian classification also. I am not telling here because if people will get confused. If the examiner want to ask the question means he will ask in the, yes, the Indian classification only. It's given by the WHO. So keep remember this one. It's more than enough. Okay. So very important one. So BMI is also called as, body mass index is also called as Quetelet index. How will calculate? Weight in kg divided by height in meter square. Very importantly. And here is our one more question. So risk factor for formation of the atherosclerosis is high density lipoprotein. No, it's a good for heart. So we call this is also as a good cholesterol. Okay, good cholesterol. So increasing in the good cholesterol is not forms the atherosclerosis. So low LDL. LDL is in bad cholesterol. What you call this is the LDL is in bad cholesterol. If decreasing the blood cholesterol, that may not increase the atherosclerosis. This is also not our answer. Very low density lipoprotein. This is also in bad cholesterol. So if there is decreasing in the blood cholesterol, that may not create the atherosclerosis. If in case very low density lipoprotein means the bad cholesterol is increasing means So there is highest risk of formation of the atherosclerosis. Okay, atherosclerosis is the formation of the fatty plaque inside your arteries. That is called atherosclerosis. And the hardening of arteries is called arteriosclerosis. What is that? Arteriosclerosis. That is sclerosis. Sclerosis is the hardening. So arteries are hardening means that is called arteriosclerosis. The fatty plaque which is formation inside the blood vessels, that is what we call the, yes, atherosclerosis. The increases the risk when there is an increase in the bad cholesterols in the blood. Okay, very important. ಅದಕ್ಕೆ ಸೊ ಕೊಲೆಸ್ಟ್ರಾಲ್ ಕಮ್ಮಿ ತಿನ್ನಿ ಹಾರ್ಟಿಗೆ ಒಳ್ಳೇದು ಅಂತ ಹೇಳ್ತಾರಲ್ಲ ಅದಕ್ಕೆ ಬಿಕಾಸ್ ಇಫ್ ದೇರ್ ಇಸ್ ಅನ್ ಅಥೆರೋಸ್ಕ್ಲೆರೋಸಿಸ್ ಫಾರ್ಮ್ಡ್ ಇನ್ ದ, yes, our heart blood vessels, that is our coronary arteries, means the myocardial infarction occurs. The very important, that is what we call the heart attack. Okay, there is how many chest compression in 1 minute in the adult CPR. So if you are mentioned your answer as in 100 to 120 compression per 1 minute in adult CPR means your answer is 100% correct. Okay, so let me move for next question. The body part which should be covered in the newborn with phototherapy. So newborn with phototherapy will not cover the head, will not cover the chest, will not cover the abdomen. We will cover the, yes, the very important two parts we will cover in the patient with on the phototherapy or the newborn in the phototherapy. Yes, our eye and genitalia will cover. And what is the other nursing responsibilities? Will change position of the patient frequently and will ask for the breastfeeding every 2 hourly or the demand based. Whenever the baby asks and whenever the baby is cries, that time you will encourage for the breastfeeding because there is a chance of the dehydration, and you will expose each and every body part thoroughly except the eye and genital. So we will cover the eye and genital with the gauze pads. So because this eye and genitals of the newborn immatures, so which are very sensitive to light, there is a highest risk of damage to the eyes and the genitalia of the baby. So we'll cover the eye and genitalia of the baby with the pads. There is the gauze pads in the hospital very importantly while giving the phototherapy in the patient with the, yes, the jaundice. Okay, very important. So next question comes like this. The antiseptic solution used in the patient with positive HIV. If the patient finds positive for HIV, so which of the following is the antiseptic solution you will use? Cresol you will use? No, you will not use cresol. Glutaraldate? No. 70% of isopropyl alcohol, that is our hand rub that we will use in our hospital, that is the 70% isopropyl alcohol. This also will not use. So we will use the, yes, the sodium hypochlorite 1% we will use in the as an antiseptic solution in the patient with the positive for the HIV. This is your answer here. Okay, so the next question comes like this. The test used to assess the balance and vestibular function. So balance and vestibular function is assessed by which test? Is this assessed by this Snellen chart? No, it's not assessed by the Snellen chart. Snellen chart is used to assess the, yes, visual acuity. We will discuss on the Snellen chart in detail. Okay, and our calorie test we will use to assess the balance and vestibular function. Very, very important. So calorie test I will explain in detail, and I will take one special short video on this calorie test. Very important test to remember. Okay, so another one question is here. A patella bone is example for. So we are having the short bone and we are having the long bones. We are having the short bones and we are having the sesame odd shape bones, that is the bean like shape bones. So we are having the irregular bones. Among those, patella is in which kind of the bone? Is an example of the, yes, the sesamoid bone. Sesamoid bone. Very important. So in the flat bones it comes our, yes, the scapula, yes, the pelvic bones, ribs will comes in the flat bones. The short bones, it comes our bone of the, yes, our phalangeal of the, not phalanx, that is our carpals of the our foot and tarsals of the hand. So very important. Sorry, tarsals of the foot and carpals of the hand. Very importantly, and long ones we are having the examples like in our humerus, radius, ulna, femur. Yes, the longest bone is the femur, and the shortest bone that is present in our body is the, yes, it's a stapes of the ear ossicles. So in ear ossicles, we are having the mesh bones. Mesh means malleus, incus, and stapes. Okay, this stapes is the shortest bone of the body. Okay, and longest bone of the body is our femur. Is the longest bone of the body. Very important. You have to keep in your mind. Okay, the patella is an example of the, as the sesamoid bone. Okay, best method to collection of the urine for the CS. So anytime in the micturition means the flow is started, anytime you can collect. No, this is not like this. So end of the micturition, so we will not collect at the end of the micturition. Starting of the micturition also will not collect. The best sample is always and always will always the midstream urine is the best sample for the urine culture and sensitivity. What we will educate the patient, we will ask the patient to clean the genitalia. Okay, we will give the sterile container to the patient, and we will ask the patient to collect the urine in the sterile container, and along with that, we will educate the patient to open the lid and put the urine and don't touch inside part of the, yes, the bottle. If the patient is touching inside side of the bottle means it's get contaminated, so which gives the false result. So we will educate the patient to clean the genitalia and hold the box from the outer surface only, not to touch the inside of the box. Okay, so this is how we will collect the urine, and we will ask the patient to void first part of the urine in the washroom, and then the middle one what will collect comes, it will collect in the, yes, in the our container, and then so the last part will go in the washroom only. Okay, very important. This is what we call the collection of the midstream urine, means the middle urine will come now, that one we will collect, that is the what we call the midstream urine. So this is the answer for our question of the Kgmu question. Okay, what is the asbestosis? Asbestosis, is this an occupational disease? Is this an airborne? This is the waterborne? This is the vector-borne? No, it's not an vector-borne. In the vector-borne disease, we are having, yes, we are having the malaria, we are having the dengue, we are having the kala ajar, we are having the lymphatic filariasis, we are having the chikungunya. So this is all our vector-borne disease. Waterborne disease, we are having the, yes, the typhoid and other GI related diseases, and airborne diseases we are having the measles, mumps, and all. So asbestosis is an occupational health disease. In occupational health disease, we will study the farmer's lung, that is due to the inhalation of the, yes, the dusty hay, and that is, and we will study the bagosis also, that is due to the inhalation of the sugarcane dust, and we will see the, yes, uh, due to the cotton inhalation, we will see the due to the asbestosis inhalation, we will see the asbestosis also, and we will see the biocinosis due to the inhalation of the cotton dust. There are many occupational health diseases are there. We will explain those diseases in the future classes. Very important diseases. So here it comes for the end of this session. So I will try to collect the more questions in the next session. So very importantly, we have discussed the question that is came in your KGM examination. So please check your answers, and I have explained each and every rationale for all the options which I have mentioned in these questions. So if the video found informative for you, please subscribe to my channel and share this video with your friends, so that may helps to those peoples also, in order to, yes, the clear our concept. Okay, so all the best for you all. Thank you.